So, good evening, ladies and gentlemen, and welcome to the Community Development Advisory Committee's annual public hearing on community development needs and past performance. I'm Ali Ghanem, chairperson of the Community Development Advisory Committee. The Community Development Advisory Committee is appointed by the county executive to assist him in planning related to community development activities. The committee is charged with reviewing the community development block grant applications and making funding recommendations. To inform the committee's decision-making, this public hearing allows residents and interested groups to testify on current community development needs and the county's past performance in meeting those needs. The committee will also accept written testimony from individuals or organizations that do not wish to make oral presentations. Written testimony should be submitted to the Division of Finance and Administrator no later than 4 p.m. on November 3rd, 2022, for consideration by the committee. Each individual wishing to speak should hold their comments to 3 minutes, and persons representing organizations will have 5 minutes for their presentations. The committee will be given the opportunity to ask questions of each speaker after their presentation. Please remember that tonight's testimony is to address community development needs and past performance, and not the specifics of any application under consideration for funding. All applications for funding will be contacted and given a separate opportunity to meet with members of this committee. At this point, I would like to ask the Community Development Advisory Committee to introduce themselves in alphabetical order and state the geographical location of their residence. So I will go through one by one, and when I call you, if you're here, please go ahead and introduce yourself and let us know where you are from. Sorry. Okay, we will start with Henak Mengistu.
Hey, good evening, everyone. My name is Henak Mengistu. I work for a real estate company as a resident service coordinator in Washington, D.C. for a very affordable housing management company. I am currently residing in Silver Spring, Maryland, near Rock Creek Forest Elementary School.
Thank you, Henak. Okay, next up we have Kenneth Nelson.
Good evening. I'm Kenneth Nelson. I reside in Silver Spring, Maryland, and glad you're here.
Thank you. All right, next we have Jared Meacham.
Good evening, everybody. My name is Jared Meacham. I reside in the Four Corners neighborhood of Silver Spring. It's a real pleasure to be here with you today.
Thank you. Next we have Patrice Williams Johnson. Is Patrice with us? Okay, maybe not. Next we have Tamika Duell.
Good evening. Well, is it unmuting?
Hi,
okay. Good evening, everyone. My name is Tamika Duell, and I'm a business owner, and I stay in the Durwood area of Montgomery County.
Thank you. All right, next we have, well, I'll introduce myself. As I said, I'm Ali Ghanem, and I live in the Montgomery Village area. So thank you all for being here. Next, I hope I pronounce this correctly, Nebeyu Isaias. Are you here? Okay, maybe not. Okay, next we have Leo Elias.
Yes, good afternoon, everyone. My name is Leo Elias, and I currently reside in the downtown Silver Spring area.
Thank you. All right, next we have Kabirul Islam. he here? Okay. Next, we have Jesse Thomas Lim. All right. Next, we have Gabriela Lemus. All right. Next, we have Enishal Miller. All right. Next, we have, I'm sorry?
Jesse.
Oh, Jesse, go ahead, Jesse. Sorry, go ahead.
Yeah, sorry. I've been playing for the mute and unmute, so sorry.
Sorry, go ahead.
I'm in Germantown, Montgomery County.
All right, thank you, Jesse.
Sure.
I will, next one is Andrea Moniz. I think it's Moniz. All right, next we have Dion Edwards. Dion here? Did I hear? Okay, maybe not. Next we have Willa Dumbuya. All right. Next we have John Petruska. All right. Next we have Andrew Messick.
Yes, good evening, everybody. My name is Andrew Messick. I reside in Gaithersburg in the downtown Crown area.
Great, thank you. Next, we have Joyce Walker. All right. Next, we have who will, I believe, will not be joining us, but Jacob Fate. And last but not least, we have Hubert Smith. Is Hubert with us? All right. So.
I don't know if I don't know if I was unmuted before. It may have taken some time for me. This is John Petrushka.
Go ahead, John.
Yes. So I'm here listening in. John Petrushka with the meeting. It's good to be here. Thank you.
And where are you located, John?
Wheaton.
Wheaton. Thank you.
Mm-hmm. No problem.
Hey, this is Dion Edwards. Sorry, I couldn't. Technical difficulties. I'm coming out of Clarksburg, Maryland.
All right. Thank you, Dion. Okay. Is anybody else before we move to the next section? Is there anybody else that was not able to speak before?
Islam. Yeah, go ahead. Put your microphone is muted. Put your microphone on. Okay.
Yeah, this is Kobril from Montgomery Village.
Thank you.
Welcome.
All right, so I think we've gotten everyone that's here now. So we would now open the public hearing on community development needs. I would like Mr. Trivens Carbo, Senior Planning Specialist at the Department of Housing and Community Affairs, to come forward and present testimony on behalf of Ms. Kathy Mahmood, Chief of Grants and Asset Management at DHCA.
All right, good evening to everybody, and we want to just thank you for being here. Kathy Mahmood, as Ali the chair just stated, she's out today. She's out on the family emergency and she couldn't be here with you, but she sent her special regards to everybody, to the CDAC member and to our guest. My name is Trevens Cargo. As you stated, I'm a Senior Planning Specialist at the Department of Housing. On behalf of the Department of Housing Director, Mr. Hassan, I want to thank you for volunteering for Montgomery County Community Development Advisory Committee and welcome you to this public hearing on the community development needs of the county. The CDAC recommends how Montgomery County competitively awards federal community development grants funds. Funds from the federal community development block grants, home investment partnership home grants, emergency solution grants are awarded to Montgomery County annually. The CDBG and the home programs are administered by the Department of Housing and Community Development Affairs, while the ESG program is administered by the Department of Health and Human Services. Funding allocated for these programs by the Congress varies slightly each year. For the current fiscal year 2023, the county's CDBG funding has decreased 4% from the previous year for a total of just under $5 million, while the home program funding has gone up by 12% to over $2.2 million. The ESG funding, meanwhile, stayed virtually the same this year at $430,000. We anticipate approximately the same level of funding for fiscal year 2024, which begins in July 1, 2023. The recent COVID-19 pandemic emergency hit Montgomery County residents and businesses hard. The county responded with its own resources to address the resulting needs of tenants and homeless persons. This effort was supplemented by a multitude of federal and state monetary contributions. Additionally, the state of Maryland contributed $3.5 million in CDBG COVID funds for rental payment assistance for tenants facing eviction due to hardship caused by the pandemic. Meanwhile, some $6.2 million of federal CDBG COVID fund was set aside for homeless shelter support, and another $6.3 million in federal ESG COVID fund were dedicated to emergency shelter support. The county provided emergency relief grants to micro businesses that face extreme hardship, financial hardship due to COVID in the amount of $1 million federal CDBG COVID funds. Soon, Montgomery County is slated to receive a new allotment of $7.3 million in home funds from the American Rescue Plan, which will address additional unmet housing needs, including for those who are homeless and at risk of homelessness. Despite our best effort, the county's community development needs remain significant. Our federal funds provide an important contribution to meeting these needs. Federal funds are being used currently to revitalize older residential neighborhoods, to help low and moderate residential through the creation and preservation of affordable housing, and to support the activities of nonprofit organizations providing a wide range of services benefiting low-income residents. All annual federal home and CDBG funds are used to assist low residents of Montgomery County, and each has its own set of regulatory requirements that must be met. For example, HUD requires that county CDBG funds be spent in low-income areas and activities that directly benefit people with low and moderate income. In Montgomery County, a family of 4 that earns $90,000 or less meets this threshold. In addition, the cities of Rockville and Takoma Park participate with Montgomery County in implementing CDBG activities. And like the county itself, each carries out a citizen participation process to determine which activities best suit their community development needs. Home program funds are primarily provided as loans to developers for the acquisition, construction, and rehabilitation of affordable rental housing. The ESG, on the other hand, are funds used to assist persons who are homeless and who are at risk of being homeless. A more detailed explanation of all these 3 programs that I just highlighted and expanded information regarding community development needs can be found in our newly completed 2023 action plan for Montgomery County on the department website. And this action plan is being worked on by, the work is being done by Catherine, our able Catherine. Testimony here tonight begins the process of identifying needs that were reflected in the development of our annual action plan for county fiscal year 2024. So that's the importance of this current public hearing, so that the needs, so that Catherine will be able to get on the action plan for 2024. Montgomery County worked closely with the Office of Human Rights and other stakeholders to affirmatively further fair housing in the county, which is a big deal for HUD. The county has made progress in addressing previously identified impediments to fair housing, but more remains to be done. This year, the county is partnering in a regional efforts to complete a comprehensive analysis of impediments to fair housing choice for the entire metropolitan area. This study, which includes extensive community outreach, will identify any fair housing issues and barriers that needs to be addressed. Providing affordable housing and supportive services for vulnerable population continues to be a high priority. Key challenges today include creating affordable, sufficient to meet the demands, delivering linguistically and culturally appropriate services to our diverse county residents, and providing services to seniors, youth, veterans, homeless, and persons with disability. This hearing will provide you with additional insight into the community development needs and will serve as a forum for comments on our effectiveness in meeting these challenges. The work of this Community Development Advisory Committee is essential in ensuring that CDBG funds that are designated for nonprofit services go to nonprofit organizations that meet the needs of our low income. On behalf of the department, I commend each of you for your willingness to volunteer, and I extend the thanks of the director, Mr. Asim, for your service on this committee. I also want to thank you on behalf of our federal program, which is headed by Kathy, and our team, Catherine, at DHA for your service. And thank you. We hope you get a participation to the hearing. Thank you very much.
Thank you, Trivens.
Yeah.
All right. So for our next thing on our agenda, we will be opening up for some comments from different, for our presentations for different speakers. I would like to remind all of the presenters that they have 5 minutes, and before they start, they should state their name, their location, and the organization they're representing. Once they finish their presentation, then we will have time for the committee members to ask questions. So the first speaker that we have for tonight will be, I hope I pronounce it correctly, Dr. Odile Brunetto.
Perfect. Thank you so much.
Thank you.
So good evening, everyone. Thank you so much for the opportunity to be with all of you as we do every year. I really appreciate that. And thank you for serving as volunteers on this very important team to look at the needs in the community in light of the CDBG opportunities in the county. So I work for the Department of Health and Human Services, and I'm the Chief of Aging and Disability Services. And when I was first hired in the county back in 1982, that was even before HHS was created, I had the great privilege to be working as the Homeless Services Coordinator back in the days. And I know soon you're going to hear from my wonderful colleague, Amanda Harris, about the work that she's doing with her team in that space. Regretfully, I had to tell you that we are seeing more and more older adults who are residents of our homeless shelters. I believe the latest statistic indicate that close to 14% of residents in our homeless shelters are over the age of 62. So that is definitely a great concern of us. In my work, I am very privileged to work closely with 3 wonderful commissions, just like yours, volunteers who are dedicated to focusing on special needs in our community. I work with the Veterans Affairs Commission, the Commission on People with Disabilities, and the Commission on Aging. So I will go over their priorities. They have done tremendous work on looking at the needs that they see from their perspective and are advocating for those needs for FY24. So let me first talk about the Veterans Affairs Commission. One, they have clearly multiple priorities, but one of them is establishing a veterans peer support program. This would be for veterans who have recovered and engaged in services, and they can coach and be a mentor for a new veteran who is experiencing challenging situation with substance abuse or mental health challenging. And these type of programs with a peer counselor has proven to be very effective, and they would like very much for something like this to be established here in our locality. Another priority of the Veterans Affairs Commission is increasing the vouchers that are available through HUD for relocating veterans who are experiencing a loss of housing. And I know that with the HUD application process, we have had successes, many successes, but obviously we need more of these HUD vouchers. They also are interested to continue full funding of public safety. They would like to see continued efforts in public safety effort all around, including pedestrian safety, because we have had regretfully a lot of loss of lives on the streets and roads of Montgomery County with crashes that have been fatal for pedestrians. Also, they would like to see the continuation of a program that has been very successful in partnership with the local Mental Health Association of Montgomery County. And that program is called Serving Together, and it is a program whereby veterans can access mental health services with trained professionals, and they would like to see that continued. In addition, there is a program called Warrior Canine Collection, which is for special dogs to be trained to be serving as assistant for veterans who need that support, either be physical support that the trained dog can provide or emotional support from a trained dog. They also are interested in increasing the accessibility of a special boat launch at the Seneca Landing Special Park, because a lot of veterans really appreciate and enjoy this activity, but the landing patch needs to be protected and accessible for veterans. I'm now going to continue and talk about the priorities from the Commission on People with Disabilities. One of their priorities has to do with safety with transportation. Similar to what the Commission on Veterans Affairs have indicated, safety on the streets, on sidewalks, because again, regretfully, we have seen an increase in fatalities for pedestrians who are older and with disabilities on the streets of our county. The Commission on People with Disabilities is also interested in seeing increased support for services for persons with developmental disabilities, increased funding from the county, and also they are recommending the establishment of a separate commission just to advise the county executive and county council about the needs of persons with developmental disabilities in our county. We also would like to see increase of mental health services for older adults who are homebound. There is regretfully a wait list for these services. This is a service that is provided under contract with a nonprofit agency called Affiliated Santé Group, and the Commission would like to see this funding increase because of a wait list for people who are homebound and need that mental health intervention. They also would like to see more progress in the area of early intervention and early screening for babies who are born with developmental disabilities. There is clear evidence from the research that if you identify a baby early on, before the age of 18 months, and provide intervention, there is really good progress and better outcome for that little baby as soon as you can identify there is a need for intervention. Also, the Commission on People with Disabilities would like to focus on employment for people with disabilities. The employment rate for persons with disabilities who want to work is very low. It is less than 19%, and they would like for Montgomery County to increase their efforts in the area of employment for persons with disability. The same thing as the Commission on Veterans Affairs, they also would like to see that boat launch at the Riley Lock park to be accessible and have a better protection for the elements for people who are using that. Moving on to the Commission on People with Disabilities, they also have numerous priorities. One of them is to increase the ability of home care services for older adults and people with disabilities who are at home and need a person to come into the home to help them out with their activities of daily life. And so we have numerous wait lists for state-funded, for county-funded programs in the area of home care and personal care, and the Commission on Aging would like to see progress being made so as to reduce the number of people waiting for this service. The Commission on Aging is also very much interested in increasing the county's ability to reach out to older adults and their caregivers to let them know about the services that are available in the county. And they are advocating for a new full-time position to focus on that outreach, specifically to underserved population in the aging network. Also, the Commission is interested in increasing the availability of hearing aids. As you know, those devices can be quite expensive, and they would like to see a program whereby hearing aids would be available for people who cannot afford it and would clearly benefit from having an hearing aid available to them. Commission also very focusing on telehealth and telecare and enabling older adults who don't have access to the right equipment or internet to be able to engage into communication with their medical providers online. And so they're advocating for additional funding for that as well. Also, the Commission on Aging is interested in better training for taxi cab drivers, because we have had some situations where the quality of service was reported by the utilizers of taxi cabs as not very satisfactory. And so the Commission is aware that there is a national training program for taxi cab drivers, so they can be better equipped in assisting persons with disabilities and older adults to have a safe trip in the taxi cab. They also are very aware that there is more need for transportation assistance for persons with disabilities and older adults, and would like to see that increase as well in terms of county funding. And they also are in support of increasing these mental health programs for people who are homebound, who need to access the services but are not able to leave their home due to physical and or mental health disabilities. So that is what the Commission on Aging also is advocating. So as staff, we have seen, again, as I mentioned, increase in wait lists for state and county programs. We have seen, regretfully, great difficulty for home care providers to hire and recruit and keep trained staff to provide services in people's homes. We have seen an increase in adult protective services referrals. People who are being abused, exploited. We have seen a great increase in that. And also we are concerned about the long COVID recovery, which is still quite unknown in terms of the impact of this long COVID for persons who are with disabilities or elderly folks. So those are some of the highlights I wanted to share with you today. And again, thank you for the opportunity to be with you. And I'll be glad to answer any questions you may have.
Thank you. Thank you. So if any member of the committee has any questions, now would be the time to go ahead and ask.
I also want to point out that I do have written testimonies from my 3 commissions, and I will be glad to send it to staff so you can have that for your records.
All right.
That's what I was just going to ask for. I was going to ask if you had an itemized list of these priorities. I've tried to do my best here on paper, but it's pretty extensive. So I'd love to have that if possible.
Absolutely, absolutely, absolutely. Yes, we'll be glad to do that.
All right. Thank you. Are there any other questions before we move to the next speaker? All right. Thank you so much, Doctor. All right. So our next speaker will be Amanda Harris.
Okay. Can you hear me okay?
Yes, we can hear you.
Okay. I'm Amanda Harris. I'm the Chief of Services to End and Prevent Homelessness. I live in the Montgomery Knolls neighborhood of Silver Spring, and I am representing Services to End and Prevent Homelessness within HHS and also the Interagency Commission on Homelessness. And thank you for inviting me again to share what we're seeing on the ground and what are some of the priority needs for people experiencing homelessness or at risk of homelessness. I will touch on some of the things that my colleague and friend, Dr. Brunetto, mentioned, in addition to some other things. So I'm going to get right into it. I will share some kind of the state of homelessness in Montgomery County and then talk about our specific needs. So over the last several years, Montgomery County has had some tremendous success in ending homelessness. We were one of the first 4 communities to end veteran homelessness, and that was accomplished in 2015, and we have largely sustained. We have reduced chronic homelessness, which is long-term homelessness for people with disabilities, at one point by 90%. At this point, we're at about a 65–70% reduction. We have also decreased family homelessness by about half, by about 50%, and then a 36% reduction in individuals, so adult-only households. So we're pretty proud of those accomplishments. Also, in the last 5 years, we've had almost a 50% reduction in unsheltered homelessness. So when I talk about unsheltered homelessness, that is people that are sleeping outside in tents, on benches and bus stops, or in their cars. We've also had a 34% decrease in unaccompanied youth. So young adults, that's 18 to 24. And I think most excitingly, although the pandemic put a lot of people experiencing homelessness at risk of not only contracting COVID, but of COVID complications, and also put if they were housed, their housing was often in jeopardy, and many people unfortunately lost their housing. But what the pandemic did bring is a significant amount of federal resources, federal and state resources. And so we've made some strategic decisions about how to use those resources, and we have actually been able to house 1,009 individuals and 236 families in the last 2 years. That is double what we were doing pre-pandemic. So that's really, really good news. The unfortunate news is that although we house that many people, we had over 1,200 individuals and 284 families enter homelessness during that same period. So that's a net gain of 253 households. So even though we're housing people at twice the rate, we still are not able to house as many people that are coming into our system. So we have to find a way to turn off the faucet, so to prevent people from entering homelessness, and also unclog the drain so that we can move more people along quickly. That has been particularly challenging over the last year. One, because of rising rents. Rents are very expensive, and although we have housing subsidies, we can only pay average rent or fair market rent, and those rates have not caught up to the actual cost of rent right now. There also is just less turnover in units, so finding them is harder, and landlords are making some difficult decisions, and I appreciate their perspective that they have lost a lot of money over the last 2 years with people not paying rents. They haven't been able to make the repairs, so I think they're in some ways trying to catch up. They're being somewhat selective in who they rent to, although there are fair housing protections. They're not always adhered to. And then also in Maryland, there is no protections, no just cause eviction protections. So if a landlord chooses to not renew the lease, they don't have to have any reason to do that. So even people that we have currently in housing, their properties are not renewing their lease, so then we have to find them new housing, in addition to finding housing for the people that are newly homeless. So that's a real challenge, and so we are looking at all kinds of creative ways to increase landlord recruitment and retention. So that's definitely a community need. We would love to have some deeper partnerships with our nonprofit housers, other affordable housing projects, so that there is set aside, there's some willingness to house our folks, and we can bring the subsidy. So any kind of tenant supports to those landlords so that they feel more comfortable doing that would be of great benefit. We also, as Dr. Brunetto said, we are seeing an increase in the number of older adults entering homelessness for the first time. It is hovering around 12 to 15% are people that are over 62, but of late we are seeing more and more people that are even older than that. So more and more people are coming in that are over 70. We've had a 92-year-old woman in our shelter system, and we are seeing more and more people that are in their late 70s, early 80s. And we're trying to accommodate, but that is not the right environment. A shelter is not the right environment for someone of that age. So what we're looking for is we need more deeply affordable housing for people that are on a fixed income, and that would include people with disabilities. We need to have housing where people are not paying any more than $500 a month in rent. That's what they can afford on the very low fixed income that they're on. And then there's other things that we'd like to see to support people once they are in housing, if they have a subsidy, particularly for our older adults, is somatic and behavioral health support so that they can age in place. And then also ways to prevent the isolation. So connecting them with senior centers, having some friendly visitors, really ensuring that there's that community integration piece, that it's not just enough to put people in housing, but we need to help them become part of the community with friends and families and faith, the relationships with faith-based organizations. And then the other big issue for us in homelessness is that there are major racial disparities in the homeless continuum. So Black or African Americans make up about 60% of people identifying homelessness or identifying as Black or African American, compared to about 18-19% of the general population. Black or African Americans are 6.64 times more likely to experience homelessness, and that gets even worse if you're talking about families. So Black families are 11.7 times more likely to enter the homeless system than any other racial or ethnic group. So we are really looking at ways that we can combat that, and that's not just about the homeless system, it's about the other systems, decades of housing discrimination, systemic racism in our criminal justice system, foster care. Foster care is another feeder into homelessness. So partnering with organizations to address the upstream efforts to try and combat this disparity in the homeless system. Let's see. I think that's it. So, again, really wanting to invest in deeply affordable units. That doesn't include case management, but it's really for people that are just on a fixed income or they make incredibly low wages and they just need a cheap place to live. Increasing those somatic and behavioral health services, increasing any kind of community integration services, mentors, companions, social outings. And then the last thing I will mention is special projects or special housing opportunities for youth. We are seeing, I wouldn't say an increase, but ending youth homelessness is definitely on our agenda and something that we want to do. Youth homelessness looks very different. Youth are not generally staying in our shelters. They're often couch surfing, sleeping in apartment complexes in the hallways. So figuring out how we can outreach and engage them, and then what are the right housing solutions, which could include shared housing, host homes, other creative ways of providing that housing, and also providing some support services so that they can go on and lead successful lives. So thank you very much, and I'm happy to take any questions.
Thank you. So yeah, now if anyone from the committee has any questions, please feel free to ask.
Yes, I have a question. So you had mentioned youth homelessness, and LGBT youth are twice as likely to be homeless as others, and that gets even worse when we talk about Black and brown communities. So my question is, what kind of things are being done in that realm, and not just with LGBT youth? That's just the one that is much more prevalent and that wasn't really discussed. So I'd like to hear a little bit about that if you have anything on that.
Yeah, we're working on it. I will say that the youth homelessness efforts have kind of come in fits and starts. We do have a drop-in center, a youth drop-in center that is located in downtown Wheaton. We've had a change in service providers, so they're hiring up now and trying to do that outreach to engage people to come in. And we do partner with Smile, which is an LGBTQ serving organization based out of DC. So they are at the drop-in center and are coordinating with us. This is something that is definitely on my radar and something that we are looking to increase those services. At this point, we don't even ask about people's sexual orientation. We ask about gender identity, but we don't ask about sexual orientation. So that's the first step, is really understanding what is the need, what's out there, what does the landscape look like, and then figuring out what are the right kind of services. I know DC just opened an LGBTQ adult shelter, which I think is amazing and great, and might be something that we look into, but we would need to understand what are the numbers.
Thank you for that, ma'am. And actually, a quick follow-up, if you had any documentation or anything about the work you guys are doing in that realm, I'd love to have access to that if possible. And my one follow-up question is about veteran homelessness in Montgomery County. And because of course the LGBT community and veteran communities are both things that need some specific assistance that maybe others don't, for PTSD and other things like that. So I would also like to hear a little bit about that if you have any information on that. And I appreciate your time as well.
Yeah, I can direct you to our website. There is some information there. We have several reports and some stats and other information. And then if you are still feeling like you want more, I'm happy to have someone from my staff reach out to you and have a deeper conversation.
Yes, ma'am. I'd very much appreciate that.
Thank you. All right, any other questions? All right, thank you so much, Amanda, and it's good to hear from you. And we will now move to our next speaker, which will be, so our next speaker is going to be Abe Schumann, but he is not able to join us, I was told. So, but we do have his written testimony. If anyone is interested in having a copy of that, we can give that to you. So okay, all right, so our next speaker is going to be Robert Goldman, if he's here.
Can you hear me?
Can
you hear me?
Yes, Mr. Goldman?
Yep.
Okay, go ahead.
Good evening, everybody. Want to thank you for your service. Many years ago, I was serving on this committee and come to appreciate all that you guys are doing tonight. So thank you. My name is Robert Goldman. I'm the president of MHP, and I want to thank you for allowing me this opportunity to address the committee as it begins the process of evaluating applications for CDBG funded public service grants. For those not familiar with MHP, our mission is to preserve and expand quality affordable housing in Montgomery County, and MHP owns over 1,800 quality affordable homes in the county, provides before and after school programming to more than 300 county children, and works directly with various commercial and residential neighborhoods to address quality of life issues that are holding them back from reaching their full potential. And while many households have been able to put the pandemic in the rearview mirror, for many low-income households served by CDBG grants, the pandemic has not ended. This is most manifested in residents' ability or inability to pay rent. MHP has been monitoring rental delinquency since the beginning of the pandemic. And this time last year, approximately 14% of county renters living in affordable housing were behind in their rent. This year, nearly 25% of households are behind in their rent. And while renters may not owe as much in back rent as they did a year ago, more renters than at any previous time are unable to pay their rent in full. This means thousands of additional households are at risk of eviction. To help renters get back on their feet, affordable housing providers are supporting residents in new ways and which are oftentimes invisible to the general public. One of the greatest needs our residents have now is finding better employment. It's almost impossible to watch the news without hearing about the record low unemployment we are seeing across the country. But by the numbers, unemployment is at its lowest level in 50 years, but household income for many of our residents is still less than what it was prior to the pandemic. Some residents are still out of work, but many more have found new positions but are earning less than they were 3 years ago. From the outside, it may seem like workers have unprecedented leverage to change jobs, quit, and get new jobs, but the reality is quite different for households that are already under financial stress. And because of this, MHP has taken a proactive approach to identifying residents who need better paying jobs and provide them with career counseling and job search services. In the last 5 months alone, we've connected over 40 MHP residents with career counseling services, helping most find new employment that increases their household income. As government-funded rental assistance programs wind down, one of the biggest challenges we face is keeping families stably housed. We as a county must pays special attention to households that have suffered financially during the pandemic and who became dependent on rental assistance to pay their maintain their housing and transition them to a new normal. We've been pushing the county, state, and federal leaders to invest in workforce development initiatives like the one we created and pair it with modest rental assistance to help families keep stably housed. And without these kinds of targeted interventions, evictions will increase, leaving more people with fewer options for housing. In addition to household income, the pandemic has had devastating impacts to student achievement, which will play out over many years. Locally, data shows that Black and Hispanic students suffer the greatest impacts with large declines in math and literacy proficiency while school was fully remote. Students from low-income families receiving free and reduced meals, the types of families MHP houses, suffered the greatest declines in performance. MHP's work in summer programs and after-school programs for our residents have confirmed that the MCPS data, COVID has exacerbated existing disparities in educational outcomes for Black and Brown students. Addressing the learning gaps created by virtual learning is going to require being intentional and direct to know each student, to know what their learning needs are and address them. As a county, we are fortunate to have access to programs such as CDBG, which can help families escape poverty, build economic security. We must continue to find innovative ways to connect low-income residents to quality, affordable housing, impactful educational opportunities, and pathways to economic opportunity. I welcome the opportunity to answer any of your questions.
Thank you. So if any member of the committee has any questions, please feel free to ask now.
Mr. Goldman, you made a point about student achievement. Did you find anything where parents in your facilities who might have wanted to increase their skill development, were they sharing that they had a desire to do that as well, or it's just the children that are being more affected than let's say the parents?
I think the family, we work closely in the programs we do. We work very closely with the parents. We feel that it's not just the kids and that the parents have a role. And so we do a lot of programming with the parents. Even during the pandemic, a key factor was, for example, getting computers and the hotspots from the schools to the kids, making sure they got them, but then making sure the parents knew how to turn the computer on and get their kids situated for class. And so there was a lot of learning that needed to go on and teaching that we needed to do to make sure that the parents could be active participants and make sure that the kids were, participating in the education. And we saw, we've heard anecdotally a lot of stories of kids who didn't have that benefit and who were not coming to class, no fault necessarily of their own, but more of a lack of knowledge of how to do that.
May I add something to that?
Sure, go ahead.
Oh.
I'm sorry, I can't hear you. I don't know if you're on mute.
I don't know if she's muted.
Okay, Willow, we on mute again, Willow.
We can hear, well,
I can
hear you now.
Unmute, wait a minute.
Thank you.
You're perfect.
Can you hear me now?
Yep.
Yes.
Yep.
Yes, hi, my name is Willa Demboya, and I got on a little late. I'm from the Silver Spring area, and I'd like to add something to what Mr. Goldman has expressed. I work for the Montgomery County school system. I'm a 4th grade teacher. The pandemic has really still is impacting student achievement. Although I have 4th grade students, they're really in the 3rd grade. So they virtually are a year behind. And the last year or so, Montgomery County has increased summer school, and which that was a good thing, because really I think the kids should have went to school the whole year round. So I am in agreement with Mr. Goldman that, you know, parents are really doing the best they can at this point.
Thank you.
I might have missed it. Did you say where your organization was located, Mr.?
You caught me. I did not. So our organization is based in Silver Spring. We're sort of off Route 29 in near Untech Road.
All right. Thank you. Are there any more questions before we move to the next speaker?
I had one quick question for you, sir. So you had mentioned computers and access and making sure parents knew how to turn them on and work them and all of that. What issues did you, if you did work with any of the more rural parts of Montgomery County or lower income parts, did you find that not only access to broadband internet, but access to internet that was sufficient to actually be able to use it during peak hours and not just having it available where it doesn't work good enough to actually facilitate schooling when it was online? And how do you think that going forward could help close that gap?
Yeah, I mean, absolutely. I don't know that we work in any rural areas, so I don't know about connectivity there. I will say that, I mean, it was obviously a lifesaver that the schools had laptops and hotspots for the kids. I don't know if that's like been gone away, but access to internet is a huge problem and something we really struggle with in terms of how we can sort of provide that. We're doing one partnership with the county has something called the MoCo Net, which they are providing basically free or limited low-cost internet to one of our buildings that we're renovating, and we're looking to expand that to other buildings. So we, you know, the more we can get, you know, I know that there was some limited access that Comcast and some of the other providers were providing through a grant from the federal government. So, you know, those things are critical, and I think we saw during the pandemic, had it not been for the school hotspots, a lot of, you know, we take that for granted and too often. I think too many families do not have that access, and so.
Thank you. Any other questions? All right. Thank you again for your presentation.
Thank you, guys. Mm-hmm.
Right. All right. So now we'll go to our next speaker, Peter Lowett. Is he with us?
Yes, I am.
All right. Go ahead. The floor is yours.
Good evening. So I am Peter Lowett. I'm the Executive Director of Mobile Medical Care, or Mobile Med. First, I also want to thank all of the talented individuals here who volunteered to be on the advisory committee. I'm always just so impressed at the organized, thoughtful decision process that you undergo, as well as lots of time. I'm pleased tonight to provide testimony to frame the need for community health funding. Mobile Med is a nonprofit community health center that has served disadvantaged residents of Montgomery County for over 50 years. We provide primary care to 4,000 patients annually. That's about 15,000 medical and behavioral health visits. We do that by operating 3 fixed site clinics and 2 mobile van sites, as well as 2 specialty clinics. We benefit from lots of wonderful partners. That includes the county government, many volunteers, and diverse funding sources. All of our patients are low income. 80% are uninsured, and generally those people are ineligible for public insurance programs, and that's why they're uninsured. Most are immigrants, and most have limited English proficiency. So all of these demographic factors, income, lack of insurance, linguistic challenges, are of course part of, or really are key social determinants of health. What we do at Mobile Med is seek to mitigate barriers to care access with respect to geography, cultural competency, finance, and logistics, all with an overarching focus on quality. In 2015, Mobile Med was awarded designation as what's called a Federally Qualified Health Center, or FQHC, in recognition of two things. One, our own track record of success, but second, and really important, is the fact that there's unmet community need for health services. And so even though Montgomery County overall, and I know this is a similar theme on the housing, overall, or on average, Montgomery County is one of the healthiest counties nationally. Disparities in health and health access persist. And of course, as you all know, the pandemic has only magnified and exacerbated those disparities. I'll only touch briefly on the tremendous amount of work we've done over the last 2 or 3 years related to COVID. Early on, Mobile Med pivoted to telehealth, but even in the early days, we stayed open to make sure we served in person as well. We expanded our outreach and our case management services, and we were so intentional about connecting patients to food and other resources, again, back to the social determinants of health. And of course, we also vaccinated over 4,000 individuals, really with a focus on our own patients and other hard-to-reach residents. We're really fortunate that CDBG has funded innovative mobile med projects, and I would again emphasize that what we're thrilled about CDBG funding is a focus on innovation and on projects that really may not be able to proceed without this kind of funding, to expand access to important health services. So for 3 years, CDBG grants helped fund Mobile Med's expansion of our family planning program that included long-acting reversible contraception, that's LARC, which we'd never had before. Those kind of services are often unavailable to our target population, even though LARC may be both safer and more effective for many patients. Now, similarly, this year we're applying for a second year of funding to provide diabetic retinopathy screening using high-quality cameras and linking that to teleophthalmology reading of those images. Annual eye exams are essential for patients with diabetes, but access is typically quite limited. The rate of diabetes in our patient population is really disproportionate. It's twice the national average. So by offering these services, these eye screening services within the primary care setting, without the need for an on-site optometrist, patients can be assured of maintaining this preventative care. I want to close by again noting the pandemic has demonstrated that we really need to be creative about healthcare access. Counterintuitively, during this period, many people have deferred care. So again, if people who didn't have COVID really avoided healthcare settings for their other concerns, including chronic diseases. So it was concerns about the virus as well as heightened economic stresses, family stresses, and the like that have kept people away from doctors' offices. And this is the time then that we need to make sure that we're helping people get back into regular care, get back to addressing their health needs beyond COVID. Again, it means managing chronic diseases like diabetes, taking on their other medical and mental health concerns, dealing with preventive screenings early so that treatment is more straightforward. So supporting all of these efforts are critical in order to achieve a healthy community and continue with a safe reopening. Thank you so much.
Thank you. Excuse me. If there are any questions now for Mr. Lowett, please, any member, please come forward.
Yes, sir, I do have a question. So you had mentioned low-income communities and things like that. I wanted to know if anything was geared towards the LGBTQIA+ community to include gender-affirming care that is not included in Medicaid in the state, or, for instance, HIV prevention drugs like PrEP and things such as that, if you have any of those services for that specific community?
Yes, thank you very much for the question. We do not have specific programs around gender affirming care, but we are really proud of standing up our PrEP program over the last 1 or 2 years. And so Mobile Med is very involved in outreach to the LGBTQ community, again, especially targeting people who may be uninsured or underinsured, and focusing on getting them free access to PrEP. So it's only in the last year or two, and this is not just for the LGBTQ community, but we've been much more attuned to sexual health history, sexually transmitted infection testing, screening for all patients, but particularly high-risk patients at high risk, and the like. And so, as you may very well know, we are concerned about HIV prevention. We also recognize that there's been a real surge in other sexually transmitted infections.
One quick follow-up to that, sir, and then I'll see that. Is there any, because of course you had mentioned mental health services and things like that. And so when it comes to, for instance, the trans community, which oftentimes is underrepresented big time, gender affirming care can be life or death in many situations. So I was just curious if there's any future plans to improve that, and if not, why, for instance, because it could be funding, it could be various things like that. I'm just curious.
Yeah, well, I think it is largely funding. We are always looking to be culturally competent in our care. And so in terms of our own work culture and clinic culture, we certainly want to be, we are ambitious about competency. And so we have taken, I don't want to overstate, I would say we've taken baby steps in terms of being more attuned and more sensitive and more respectful of various communities. And that means, even simple things like asking people for gender identity when registering, and really looking to, affirm with pronouns and the like. And so we are doing small steps like that. But again, I don't want to, I want to recognize that there's lots to travel there.
Yes, sir. I appreciate your time. Thank you.
All right. Thank you. Are there any other questions?
Sure. I just have a quick question. Previous years, you guys used to have a lot of vans that you would go around the county, and are you still doing that these days? And if so,
I'm sorry, I cut off the last part.
What challenges are you having?
Yeah. So
what challenges are you having?
Right. So we do still have vans. We've actually shifted most of our care to fixed sites, including 2 county sites, which we're really pleased about the generosity of the county. We do still have 2 van sites, and we really see vans as a complement, not a replacement for fixed sites. Where we can do fixed sites and where the scale warrants fixed site, for example, if we want to be a full-time site, fixed is better. Really, mobile sites are best for communities that we can't access in a regular sort of cost-effective, quality way in other ways. And so we're still in both Gaithersburg and Aspen Hill there. We actually, for 1 year, closed our vans the first year of COVID, and that was for infection control and to keep patients and staff safe, because the close confines of the van, we really basically didn't want, if basically one person was infected, we would need to shut down the entire team as they were, had to be, quarantined. And so other than that, so we kept, at that point, we consolidated into our fixed sites, but we reopened at 2 of our sites a year ago. And So again, I mentioned some of those challenges with a virus. We want to really be safe for our patients as well as for our own staff. And that certainly is a challenge. But I think the biggest challenge right now is outreach, is to make sure that people, because again, there is so much less, and I speak to, this virtual meeting, right? So much less in-person interactions, just the normal course of interactions and networking and the like, that outreach is really much harder. And that's true with other organizations as well. And the same kind of thing of institutions, faith-based and other, community-based organizations. That kind of networking that is just so fundamental to societal strength is harder. And so I would say that that's the biggest challenge. So that's outside of the clinic. Inside the clinic, we are doing our best, and we are, people do want to, when we get people back and we engage, we can really, really serve them in really a very high quality way.
Thank you so much for that.
Thank you.
I do have one quick question. You were talking about the mobile sites. Is there a certain route you guys do, or does it vary? How does it work in terms of where you guys specifically go?
Sure. Yeah, I'm glad you asked, so I can clarify. We are looking to do the same set of services on our mobile vans as at our fixed site. So we want to be a regular source of care. And so we actually have a regular weekly schedule for our van sites. So we are every Wednesday and Friday at a church in Aspen Hill in the parking lot. And we want to be relied upon in that community for regular primary care. Now, there are some things that we don't do, we don't draw blood in the van for logistical reasons. So people need to go elsewhere for that kind of service. But fundamentally, we want to be not a well-mobile, but a regular primary care source. Now, that said, the van is also flexible. We've used it for some community-based vaccine events, those sorts of things. So those are sort of one-off type of events in the community. But for primary care, we want it to be an office on wheels with a regular operating schedule, hours of, open hours.
Thank you. All right. Do we have any final questions before we move to our next speaker? All right. Thank you, Mr. Lowett.
Thank you.
All right. Our next speaker will be Jim Stowe, if he's with us. Jim, is there Jim with us? Maybe not. All right.
Yes. Ali, we were trying to reach him, and he was supposed to join on phone and made a presentation. And while Peter was presenting, I've been trying to reach him and try and figure. So far, we're still unavailable. So we can move on from there until otherwise the next 5 minutes we can move on to public comments side.
I think we have one more scheduled speaker.
Yes, we have
Susie Sinclair Smith.
Yeah, I don't know if they're still around. That's why we've been playing games around. So for now, until we get any information, we can move on to public comment and hopefully within 5 minutes, if they might be able to connect. Yeah, other than that, we can move comment any discussion you guys want to have. Yeah.
All right. So for our next thing on the agenda will be public comments. So we do this in two ways. Obviously, if there's public here that would like to comment, but we also accept written comments from the public. We do not have currently any written testimony from the public, but if there are any public comments here, let me see if there's anything in the chat.
Yeah, but according to Kathleen, there's no comment, right? Yeah, we didn't have
I don't think so. All right. Oh, go ahead. Yes.
Allie, real quick, would we consider Willa's comment about the MCPS school data? Or is she on the committee? I'm not.
She's on the committee.
Yeah.
Oh,
Okay.
Yeah.
All right.
She's on the committee. Yeah.
I'm new. I'm still learning, people.
All right. No problem.
Yeah.
No problem. Yeah.
Not that far.
That's a good question, though. That's a good question. No, but she is on the committee. So it looks like we do not have any public comments right now.
I think Jim Stone is on. Mr. Stone, check. Yeah,
Jim, are you on?
Jim, your phone. Okay, he's
I'm
not.
on.
Okay, good. Mr. Stove is on. Okay. Yeah. So yeah.
All right.
All right.
Go ahead. So, are you Jim? Can you hear me?
I sure can. Good evening.
Yeah. So thank you for joining us. So just for your period, you will have 5 minutes to speak. And before you start, if you can just give us obviously your name, your organization, and where you're located, and you can go into your presentation. Thank you.
Thank you so much, Mr. Chairman. My name is Jim Stowe. I'm Director of the Office of Human Rights. And we, of course, are part of the county government, and we are located, of course, in the Rockville Memorial Library in the Rockville Town Center, and they're available to the community 5 days a week, of course, and we are trying to roll out, and we've done fairly well in post-COVID, at least the extreme COVID environment. And so we're starting to see a little bit of traffic and those kind of things in terms of more of a routine in our office. Not there yet, but we are making some progress. Let me tell you about what we're doing that I'm excited about, and can't get into too deep, but you'll understand why. I'm very excited about a program we've engaged with that we are using some of the resources that we are getting through the home funds, the Community Development Block Grant Program, to look at the issue of the Credit Reinvestment Act, CRA. Every banking institution must, in fact, have a plan as to how it is reinvesting in the community for which they are, in fact, geographically located. And so you may look at and see folks who are merging as banks, buying banks, etc. One of the first things asked when they do the public hearings, which are required before that merger takes place, is what are you doing in terms of your investment back into the various communities? And so one of the things that we're doing is to really do a comprehensive look at that particular issue in our community. Can't get too deep into it because, again, I don't want to signal what we're going to be doing. However, let me just say this. We're looking to see whether or not those programs are in place, whether or not those programs are working, what's the economic impact. And they're not just around the issue of housing. They get into economic development. They get into also issues of creation of wealth within communities themselves. A whole lot of areas where not normally you would see, but this is, I'm talking about the issue of CRA, is part of the Fair Housing Act. And so therefore, it is the reason for which we're involved in it directly, and we're excited about some potential things that you may see in the real near future as a result of this. And so we're excited about this moving forward. So stay tuned to hear more about, hopefully, the results of this program as we go forward. This past year, we had about 39 cases of housing discrimination that occurred in the county that we, in fact, are part of our inventory of over 350 cases. And they run the gamut of various things. But what we're starting to see is a new trend in the area of source of income discrimination. Coming out of COVID, many landlords were trying to sort of right themselves, as it were, from having experienced some losses of income over the course of the time where people were not paying, and those who were paying just maybe a minimum amount. And so we started to see happening is that individuals were much more stricter in terms of who they wanted to see in their properties and whether or not those persons had the ability to pay. A source of income is a protected class in Montgomery County, one for which we, in fact, have the responsibility of enforcing. And basically what it says is that if one has a source of income, particularly now is housing choice vouchers, of which you'll hear more often, but they come in many forms. So sometimes they come in terms of some federal programs, some state programs, some private programs. At the end of the day, if this is a bona fide source of income, which landlords can verify, then that must be, again, received as a bona fide income source to rent an apartment or rent a house or what have you. And so we're trying our best to make sure the playing field is level when it comes to these individuals looking for a home and when they've got this additional subsidies or help to make that rent payment take place. And what we're saying basically to landlords is that we're not forcing you to rent to anybody that's not qualifiable as an applicant to be in that particular community. What we are saying is don't in fact put impediments in front of someone who has all but a few dollars to make the payment in the first place, because sometimes even that subsidy sometimes is the full rent. And so landlord, you have no reason to reject this individual from your residence because they can pay in full. And by the way, it doesn't come to the resident, it goes straight to the landlord. This is a no-lose proposition for the landlord. And sometimes when it's less than a full payment, what one is looking for is verify just the amount that's the difference. If someone, for instance, has a $400 payment that they're paying in rent each month, and you're trying to qualify him or her, and sometimes this happens, by the way, you're looking at not trying to qualify him or her based on whether or not they earn the $400, qualify them on the basis of where they have the additional $25, because that's all they'd be paying out of their pockets. And so again, we're just trying to be fair here. And so stay tuned again for more work in that area. We're trying to do a better job of getting word out to individuals who are going through this process. But right now, that's a predominant reason for people filing a complaint with our office at this point. The next area that gets into this whole sort of idea about housing discrimination in Montgomery County is disabilities. We used to use the fact some years ago that all of us at some point in time may be labeled disabled or a person with disabilities as we in fact get older. And one of the things we're looking at then is how do we do a better job of ensuring then that those kinds of individual issues don't in fact affect people trying to become residents in local communities. And one of the key areas that keeps popping up is this use of assist animals in homes. Being able then to use those assist animals to get around for a number of reasons within that particular apartment is a critical piece. And then the other issue we're running into now more often than not is the issue of modifications. How do I make my apartment more, again, maneuverable for me if I use a wheelchair as an example? And so in those instances, sometimes we're having landlords who will refuse for those particular modifications to be made because they don't want to affect then the aesthetics of their building, of their apartment, of their particular community. And of course, what the law is suggesting that if I ask for a modification, I don't only have to pay for the modifications, I have to also return it back to the way it was when I leave that apartment. So again, to the landlord, while there may be a momentary or temporary change in terms of the aesthetic of your particular building or apartment landscape, it's only for the standpoint of, again, being for a few minutes. And so I'll stop there just by saying this. Those are key areas that we're looking at right now as we go forward. I've got more to talk about, but I only have 5 minutes. I'm also a minister by also the blessing, the serving of God. And so I don't do anything in 5 minutes. But anyway, I'll stop right there.
Thank you. All right. So now we will open the floor for any questions anyone has for Mr. Stowe from the committee. Any questions?
Yes, I have one. So you said if I remember correctly, you said that you're from the Office of.
It's embarrassing.
What office did you say you're from, sir? I'm sorry.
The Office of Human Rights.
Human Rights. Okay, I apologize. So my question on that one is, what kind of policies are put in place to protect the LGBT community from discrimination in housing? Because of course, if a married LGBT couple puts both of their names on a lease that they're a couple, they can be denied for various reasons. And so it definitely makes it more difficult to have your spouse on your lease, for instance. So I was just kind of curious what kind of specific policies are in place to protect people from that kind of discrimination in housing.
Well, clearly in this case, there is the built-in protected class already in place that looks at the issue of sexual orientation as a huge part of our law and those that we cover. And so in the very specific case that you mentioned, I would just employ whomever that may be, if it's somebody that you know or what have you, that they would bring that case to our attention, because the law is already in place to deal directly with the particular situation you described. And so if, in fact, in our investigation, we find out that it was the signing of the lease by both parties, that in the actual leasing decision, and then that landlord is going to be able to explain that as to why that's not, in fact, discriminatory. And so that burden is not on the person to whom would be filing the complaint, but rather once we, in fact, get that allegation and we substantiate that, it now shifts back then to the landlord to, again, to justify that lending decision. So we believe we've got enough in place. Sometimes what we don't have is the actual complaint itself. Sometimes our folks out there as residents of our community, depending upon what their issues are or their concerns may be, sometimes are just so frustrated in trying to acquire the housing, as an example, that they just end up just not wanting to deal with it any longer and just simply end up going someplace else. And that happens more often than not for a number of different folks who have reasons that they feel they've been denied the opportunity to rent an apartment or rent a house. So that's our biggest issue, is having the time and the opportunity to actually pursue a case like you just described. So again, if that is a real live case that you're talking about, please bring it to our attention and let us explore those possibilities I just mentioned. And we will certainly go as far as we possibly can go in trying to remedy that situation, particularly again, if that landlord has made that rental decision based solely on, again, who signed the lease. It should be looking.
Yes, sir, and I'll definitely make a note of that. And I assume the answer is yes. I just want to clarify that it includes gender identity as well.
Thank you so much for reminding me of that. Yeah, absolutely, it does include gender identity. Thank you for
yes, I'll make a note of that to have some friends contact your office for that.
Please do, Andrew. Please do.
Appreciate you, sir. Thank you.
All right, thank you for that question. Are there any other questions?
Yes.
Let's
please go right ahead.
Yeah, go ahead, Willa. I think Willa had a question. We'll go with you first.
Yes, my question is to Mr. Stowe. What took you so long to come to this committee? This is my 4th year on this committee, and the message and the communication that you're giving us is so impressive. Then again, the question is, what took you so long to come to this committee?
Well, let me say that the last time we were in person, time before last, I was there. We were over in the COB, the council office building, and we had in the hearing room, you may recall, I think on the 6th floor, 7th floor, I think it is 7th floor. And so I was there for that particular hearing, and I'm there on most of them that I can be. I was out of town the last one, I had a conflict, that's why I was not there. Course, pandemic and so forth. But let me just say this. What we're doing is trying to put ourselves in a position. Thank you, by the way, for your comments. We're trying very much, as we possibly can, to make fair housing one of those things that, again, is just available to every person. Let me just tell you one thing real quickly that I have not gotten done. I want to get done in worse way. And you could help me with this. Now, I brought to your attention last time. I don't think you were there at this particular moment I'm mentioning, but I'm asking this committee to help me. When you go to your bank, if your bank does housing lending, if in their lobby they do not have a poster from Montgomery County government talking about the fair housing law in Montgomery County, your bank is in violation of the Montgomery County Fair Housing Law. So you can help me identify that bank and help him or her then get in compliance, because they're not. And so those are the kinds of things that, again, if people don't know, they can file a complaint with our office. If you don't have a reason to do that or be aware of that, if we've missed folks in getting the word out about them, right? What ends up happening is that folks don't know what they don't know. And so we've got to do a better job of getting out there, but we need your help, this committee. As I said before, each of you, I'm sure, bank someplace, whether it's a credit union or whether it's, again, one of the more known national banks or maybe a smaller community bank. All of them who do housing lending must have our poster displayed conspicuously where individuals who are current bankers as well as those who are new customers can see that notice. And also, every apartment complex in their rental office ought to have that poster. So I'm asking for your help as far as that goes.
All right, thank you. I think we had another question.
Yeah.
Yeah, thank you. Jared Meacham here. I'll echo Willa's sentiments. It's really a pleasure to have you here, and it's my first opportunity to interact with your office. So I'm just more interested in your scope of practice. So I think I have a good idea of what you're doing on behalf of, individual residents or families. Do you have any protections in place, however, for property owners? I'll give you an example. I met a gentleman recently who made some significant modifications to his home for a disabled lady. She ended up having to be rehoused and go to a long-term care facility, and he was left without any money or anything on behalf of the family to put his property back. And he had built ramps and just done all sorts of stuff. And he was pretty perturbed because it was going to be many thousands of dollars that he just didn't have because he hadn't charged significant rent throughout COVID and given his tenants some significant breaks. So do you have anything that helps those people as well? Or what's the scope of practice of your office with regard to where does it end and begin with regard to just housing in general?
We begin with, of course, the complaint against persons who have and are in non-compliance with the Montgomery County Fair Housing Law. You can find it in Chapter 27. And in that section, I think around 1212, I believe the number is, section is, that you begin to see what in fact is in place. Now, what we don't do is make up the law as we go. In other words, I'm saying we enforce what is already in place. But let me just say this to that particular person you're thinking about, and this is why I said a minute ago. The protection for landlords is that I can ask for the modification.
I think he got muted. Mr. Still, I think you got muted.
I'm so sorry.
Good.
Let me just restate real quickly. Let me go back and say this, that as I mentioned to whomever you're speaking of, this individual that you know who is the owner of landlord of that property, here's the protection that he or she has out there in that world. If I ask for the modification, what the law says is that as a requester, I have to pay for that ramp. I've got to pay for those modifications. And what he should have done, and I know this is kind of after the fact, I realize, but I'm saying is that landlords have that right to have that then ask of those persons when the modification. And also, there is also the ability then to have, and also, and I think you can do this, and the folks over in Landlord Tenant may correct me on this, but also can hold monies aside for the modification to be returned back to its original state as well. So there are protections in place that allows it to be done. I see Catherine's got something up here, the reasonable accommodations piece. So there is a way to do that. So there is this protection. Now, after the fact, for your particular person, there were monies available through the Department of Housing and Community Affairs, the one for which you all are part of, by the way, for landlords who were experiencing the same kind of things you're talking about. Now, whether or not his monies are left, I don't know, but they were for the very purpose of where they were getting rents that were not up to par what they needed, and also issues where they rents and so forth were not able to cover repairs and other kinds of fixing, as it were, for their units during COVID. Now, again, I don't know, sir, whether that money is still available, but again, I suspect that Trivin and others within Housing and Community Affairs can probably share with you whether monies are still yet available. But that is a real problem. That is not right. That is not fair to landlords. But to the extent that I share with you, I can only do what, again, by way of enforcing the law that actually exists in that law itself. And the opportunity that I can, in fact, enforce is to ensure then that if a person is asking for modifications, that again, they must in fact be willing to pay for that modification.
Yeah, that's very helpful. Thank you for that. I appreciate that.
Thank you. All right, do we have any other questions?
Got a follow-up question.
Oh, go ahead.
Hey, Brother Jim, glad to see you.
Hey, Doc, what's going on, man?
I got a question about the community reinvestment. I'd like to know if there are provisions in that act for reporting for banks in our region, and if we have access to that so that we can focus our questions and who we should be talking to for that. At this point, I know you're just saying you're starting in it and all of that, but is there a reporting mechanism from the act that somebody can access very quickly to find out who's in compliance and not in compliance as a public record? Every bank should have something, but I'm just asking.
Yes, sir. As I was mentioning when I first made comment in that area, I didn't want to get too deep into it because everything you just said is being done as part of the ongoing effort that we have. And again, I hope to be able to present you a full report of what you just asked for. However, in the interim, that report is supposed to be on file for the simple asking to review it to every person. So you can walk in your bank then tomorrow and ask to see their CRA plan. And they should be able to produce it for you.
I don't mean to cut you off, and I appreciate the suggestion to go. And I got banking people in my family, so I'm always having to put protective orders on me because when I started asking some questions about they're not doing, I get excommunicated from the family. So I mean, I just want to, I know you're getting into it, but I know I would appreciate a report back from you in terms of what is out there and who is. I can go out and do that. That's part of me doing a job. Yes, grant you. But there's another job we have to do together. And I think you finding that for us is a good thing.
Oh, no doubt about it. We would certainly do that. What I was trying to suggest, though, by my comment, Doc, was that the full disclosure for the transparency is built into the act itself. And so what I meant by suggesting that anybody can do it, I'm saying that to say then that the requirement of those banks is to have it that readily available for any person to, again, be able to examine that document.
I got that.
And so my point was, I know you got it, Doc. I just want to make sure that your other members might very well have a grasp on what I'm sharing as well, because a lot of us do not know this. And let me just share with you, very seldom does anybody ever ask for that information. Very seldom. So we will, in fact, be glad to get to back to your point, Doc. Glad to get to a full report to you all of our findings. And what we've done is to really shrink it down to those businesses that do business with the county. And so we're going to get a good idea of, again, what they are doing, or in this case, may not be doing. But we'll be glad to get the full report to the committee.
I appreciate your effort. Glad to see you.
Thank you, Doc.
All right. Are there any other questions before we move on?
Well, I just want to comment on what Mrs. Stove has been saying, because what's the name? Willie was talking why he didn't show up. This is why he didn't show up, because he always has conflict. People want him to be saying this stuff. This topic is so interesting that people want to know. So that's why. But we are very delighted to have Mr. Stove here. I know he's been working on some other stuff, but we are really grateful that he was able to make it. And the other thing I want to just emphasize is every time he's been sending us sending testimony, even previous years. But one thing we want to tell members is if somebody doesn't attend, but they send testimony, if we share them, you can look at them and you're free to call the office and talk to them, because you are part of the CDAC for the next 3 years if you want to be. And so, yes, you can call Mr. Stowe's office, or you can call HUI, Housing Unlimited stuff. Once their representation, you can call these people and talk to them. You're part of the CDAC. You are fully folks being appointed by the county executive's office. So, yeah, so you have those where you can talk to them. And yeah, so I just want to emphasize that those people who provide testimony, they're also important that you can go review them and contact the folks. So, Willow, yes, really, Mr. Stokes been giving testimony presentation that we've been sharing out to people. So I just want to emphasize that's important. If you have them testimony, look at them, and you can contact the agency or the office that provide those testimony. Thank you, Mr. Stokes, for coming. I know you're busy.
And one thing I would also like to point out is I saw that Catherine put a couple of links in the chat. So if anyone wants any more information about what Mr. Stowe is doing, there are some links in the chat for you to look at those.
And you folks are free to contact us, Catherine and I, and Kathy. If we need to, if you want to get any more information, you're free to contact us directly. We can help. We can guide you on that. Thank you.
Thank you.
Thank you.
Thank you for putting that in the chat. Is that record in the chat able to be shared? I'm still a little new to Teams. I just need I know some other ways you can copy and paste, but I'm not that
Well,
good.
yeah. Well, once you need that, Kathleen and I will talk about that. Then we can share those information if you guys folks need them. Yeah, we email them.
I am going to say, because I got all this good information, and I'm going to start looking at some things. There is an interest to know.
Thank you.
What this report says for our region and
Right.
for our county.
Well, that's why we do the public hearing.
Together,
so, yeah,
be able to check off together what and where and all of that. So that.
Sorry, Ali. I was just trying to make this comment quick. So you can go ahead.
No problem. It's all right.
Go ahead.
No, Trevor, no problem. Trevor's no problem with me. I understand everybody's working. Everybody's trying to do the best they can to contribute. And I'm trying to make a way to contribute as well.
Okay. Thank you very much. We appreciate that, sir. Thank you.
All right. Thank you. Thank you. Are there any final questions before we move on?
Mr. Chairman, one more thing let me just add real quickly.
Sure, go ahead.
If I may. We also embarking on training that we'll be doing, and we've got an opportunity then for hopefully maybe some of you may be able to be a part of this, but to truly understand the background of the movement itself, we have put together this mobile training kind of experience for persons. And we are excited about this because it is the very beginning of why we have the Civil Rights Act of 1964, and then of course the Fair Housing Act of 1968. And it's our civil rights educational freedom experience. And we've been doing it now for 11 years. And so it's a chance then to really understand totally why we are engaged in the process that we are, how we got to where we are today, and some of the significant events and activities that took place that allowed us to be who we are today, and why fair housing is such a huge part of all of that experience. And so that information will be coming out very soon. And again, if it's something you're able to take advantage of, we would be more than glad to have you be aware of it and to come along and see history in front of your own eyes and experience it in not a very personal kind of way. We are fortunate to have still some of the folks rather who are history makers themselves still with us, and to hear their stories and see then how it weaves itself into the history that we are by way of our experiences today. You can see how it happens, and it's just such a moving experience. And again, I would just commend that yet is another activity that we're doing to make real sure that people understand and be able to grasp and come back and share the experience with others as we try our very best to make this a county that is free of discrimination of all kinds toward all persons who are residents of our community.
Thank you, Mr. Stowe. All right, so I believe that was our last speaker. So we will now close out the public hearing. So this will conclude the public hearing on community development needs. Written testimony will be accepted by the committee until Thursday, November 3rd, 2022 at 4 p.m. Details about how to testify will be provided on screen after the meeting ends. Thank you, everyone, and thank you all for organizing and everyone that showed up and all of our presenters.
Okay, well, I want to, on behalf of the department, we also want to thank you all for coming, and all the presenters. I see Amanda is still here. We appreciate Peter is here. Thank you very much. We hope next year we can get you folks again. Now, Mr. Stowe is here. People want you to come and tell them what's going on. So people, so we hope next year we can get folks like this. It's very special. So thank you very much, and good night. And that's the end of the program. Yeah. So good night. Thank you. Bye.
Good night. Thank you.
Bye, everybody. Yeah. All right.
We're done as a group?
Yes.
Yes.
All right.
We are.
Okay.
Yeah.